Hello, my name is Dr. Herb Akers. Thank you again. I'd like to discuss a little bit about the background of my practice. The focus of my practice really is to expand everyone's awareness about how the body is working, not in perhaps small discrete parts, but how it flows with energy in the work that I do. Now typically my patient will come in complaining of a symptom. And because my practice is a form of energy medicine, I'm not just looking at pieces of it or where the pain might be. I look primarily at the flow of the energy, of how the person walks and moves and breathes. So it's really important for everyone to understand that my background, my big picture with this is more energetic rather than small pieces acting individually. This type of big picture energy medicine, and as it relates to my practice of movement as well, is really an expression of an ancient healthcare system that has different forms, one of which is yoga. I practice yoga myself. I have experience in it, but today I'm here with Shakti, Christine, who is she's a practitioner and a teacher, way more advanced than I am. But the connection between my practice and yoga really is very intimate. I personally have experienced people with health conditions who come to me as a doctor. They certainly can benefit from a yoga practice. And I really see one of my important roles is to actually move them and get them to a bigger circle that involves more than just my own intervention. The intervention of assessing and looking at the body's flow of energy, defining here's a block, help the person unblock that flow of energy, which is so important these days. I really focusing on movement. Certainly we've talked about that with the fascial body, but oftentimes I've been asked, well, where do we go from here? And it really is easy. It's an easy connection now compared to maybe 10 or 20 years ago. The popularity or the importance or the emergence or the reemergence or the evolution of yoga being so ubiquitous now, it's a perfect time. And it's an easy time for me to say, after we've worked on a patient for a few sessions where we release and unblock, but we've got to move on and into sort of a rehab version of this. And really, what I see is the movement therapy that's in the same big picture as I am would be a yoga practice. The yoga practice, well, before I mention what I think is important, I'll introduce you to Shakti and have her explain a little bit about, what the energy medicine and the movements have to do with her practice and how she has helped countless people herself. Shakti, welcome.
Thank you. It's good to be here.
Tell us a little bit about how you help your clients. Typical. They probably are different than mine. I certainly come in with people who have complaints, and you probably do as well, but I'm guessing mine would be perhaps more in an acute or an emergency basis. Some folks will come in crawling to me for help. You may not have that experience.
Right.
What have you seen?
Well, people come to yoga for a whole variety of different reasons, and people have a whole variety of different impressions of what yoga is because it's a very ancient and very holistic system. So there's a lot of different aspects or lenses you can look through into what it is. But I'd say the two biggest things are stress relief and just feeling more relaxed or more comfortable in their bodies. People chronically very tight and often have a lot of repetitive strain from working at a computer and so forth, so they come to yoga as a way to counterbalance those kinds of repetitive activities. And then there's also the approach of yoga as exercise or power yoga. That's not really my field. I'm much more into yoga as a kind of therapeutic practice, but also there is a spiritual aspect to it too. But I think mostly the goal of most just yoga classes is more about relaxing, centering, just being able to be with yourself and your body in your present moment. And gradually over time, if you do a practice consistently, you will notice improvements in yourself which are more lasting.
Wow.
And I'm hoping to see people do more at-home practice like you were speaking of, because I think that's where the most benefit comes, when we are able to really understand what we're doing enough to do it every day ourselves and really come to it with that kind of dedication. And
as I'm listening to you, I remind myself I'm envious. That's right. As of course, I envy a yoga practitioner, because you have the clientele who are ready then to listen to purpose and to follow that spiritual message that may be about a particular problem they're having. Whereas more than half the times I'm dealing with convincing people that, hey, we'll fix that back pain. We're going to correct this biomechanics, and we'll get you out of pain, and let's take less Vicodin and such. So again, I envy where you're at, where you can speak peace, and they'll hear it, and that's a nice vibe. I get that occasionally, but just not all the time. So that's wonderful.
so I'm curious how you diagnose people. You say that when someone walks in the door, you can very quickly see the pattern of their injury, and in a very holistic way that may not be really apparent to an untrained eye. Can you tell me a little bit about how you're able to do that? And I understand you were trained from a very early age in a unique method of healing.
Yes. So it was probably, I've done this since I was 6 years old. I don't know the exact age, but again, the reason why it's very normal. In New Zealand, the Polynesian art of body work is done when families, it's commonplace. So 5 kids, somebody had to do it. And with my parents both from Samoa, their healing arts was touch and body work in a very specific way, very physical. So I did it. I didn't really complain. It was doing that rather than housework, and so why not? But over the years, I think because the early training would made me pretty sensitive to it. But I think, honestly, after looking at it for years and years, saying, how come I can do this? I think I had a couple of things that sort of was conspiring against me. I had an early contact with bodywork and healing, and say, fix that, okay. But I was always a very sensitive child. Now, after I grew up and went to school and read all the research, I realized, I saw this diagram of the heart energy field is huge. And I know about myself, I can feel too much in a way, right? Because, as a little child, little boy, you're not supposed to cry, but I could feel I was perhaps too emotional. So my conclusion is, I can actually feel people's pain. And when I was in practice, I could feel them all the time. And so it just spent many years sort of dealing with the emotional responses from patients, or managing my emotional energy sensitivity to the point where I can make it work for me. So when I look at people, I guess I'm looking with my eyes, but I'm looking with my body. And my body can feel emotionally what's working, what's not working. So I'm able to not only say, well, that knee isn't working, or there's a hip problem or head injury, but also I can also recognize which is the one that's appropriate to be worked on, which is almost important than to find what's right or wrong. It's like, where's the timing through this? So that's a good question. People ask me all the time. I usually say I do the same way your dogs and cats do, and they can just feel it, which really is a resonance, right? So when we look at energy medicine, really it's a vibration. Your body's vibrating. We vibrate with that myofascial matrix. It vibrates in order to feel the environment. So we try to pick up resonances from across, out of our sight. So all the animals, and I'm thinking early humans, right? We would sense danger. Before it shows up, you'll feel it, right? It's because you can actually feel threats. That is part of the resonating vibration in the planet. With our body being that resonated liquid crystal matrix, it's also feeling it too. And so long as you keep your body turned on and open and listening, it works. If you deliberately turn it off, it won't work.
Can you tell me a little bit about the science that supports your practice?
Absolutely. It's an interesting story. Yes, I have started this very early in age. However, I didn't really look into it deeply or practice it intently until my first year of chiropractic practice in my own office. So after I got out of school, I was using the approaches that I had trained for. And what I had an experience with a particular elderly lady in acute pain, and she could barely walk or move, or she was in a problem, and I treated everything, used everything that I've learned for several weeks, and I felt so bad for her. And I said, on the last visit, I knew, where am I going to go? Before I call somebody else, I said, why don't I try something that I've learned since a child? Oh my gosh, what have I got to lose? And so you've got to understand, chiropractic has a lot of specific techniques to use, and they have lots of neurology based on technique. And I was very good at that, but I was at my wit's end. I'd have exhausted all my tools, and there's a sweet old lady who just needed something, and I just said, well, there's a gut feeling in me that says I know how to release things, and it looks pretty brutal. It looks like a deep massage, and it's almost like I'm beating an old lady up. She must have been 80 years old, right? So I said, I'm going to try this, and I did. And she called me the next day, and she was crying. She said, I've never walked like this for years. Well, just keep doing it. And it was a light went off in me and said, you know what? Just use what I've learned, regardless of what traditional science says. Look further into how can this pressure point work. And then I went from there looking at all the myofascial science, and it was just blew me away. And I couldn't understand why chiropractors weren't utilizing this more. The science behind the speed of communication, the fascia is just astounding. So I did not study it until later in my practice, my first year. I've been practicing over 30 years. It was my second year in practice, or first year in practice, I started researching. And from there, it's just built over time, where now I'm beginning to teach students myself about, what the matrix is about, how you can apply it. And that sort of brings me, like with you, why would yoga be the next step? Well, we are using and moving that energetic body. We are getting it to flow, because you folks are the ones who understand it. So you guys are sort of like the traditional technology that's been there forever, that we've sort of forgot about. So that's how I got into it, is just sort of out of desperation in a way, sort of recalling what I've already known since a child.
And it sounds like now science has come to a place where it can back that up.
Absolutely. The science has come full circle, and it's almost, I personally think the science is so astounding that it's really sort of kept under wraps, as it were. If people actually knew that movement is so important, how the flow of energy is flowing, it's less about the individual parts, but how they all work together. Some very simple concepts that yoga has been teaching for thousands of years is now becoming, hopefully, mainstream. So yeah, I'm glad it's come full circle.
So I hear you using the term matrix. Can you explain what you mean by that?
Oh, yes, sorry. Right, so when the research was done exploring the myofascia, they found and explored and did all the dissection and anatomy work, recognizing, well, where is that fascia going? Well, it is a matrix as in a three-dimensional web, where our body is part of a three-dimensional wiring system that is interacting with the environment, with all body parts at the speed of light. And so it's an amazing information transfer network that keeps us who we are, right? And so the idea that we don't have resources is not true. We have a very intelligent body that we're living inside of and constantly communicating to everything going on in the universe. It's just bizarre, but so important and practical, because if you want to, so let's, for example, gosh, I've got some back pain or neck pain, what the heck? All you've got to understand that back pain or neck problem is within that fascial matrix memory, excuse me. It's in the memory of it. So then by finding where your fascial matrix memory is talking about, where it's locking, why is it compensating, then it's a simple matter of sort of unwinding it. So yes, the myofascial matrix is that three-dimensional memory body we're living inside of, but if it has twists in it, then you will receive those twists, right? So your body will have those internal push and pressure inside your body that you're not so conscious of, but your body is very aware of this twisting going on. The wonderful thing about working with this myofascia is that it's pressure sensitive. Right? So it's a piezoelectric device, which means it's pressure sensitive, which means you can actually press on that fascia and it's depolarizing electrons. So if you know where to push and how long to push, and that you can erase and change the flow of energy. And again, yoga is known this for thousands of years. So just, yes, it's amazing, but not so amazing that we can't really start to utilize it more fully.
Yes. It sounds like you're really approaching the body as a holistic intelligence and...
Yes, absolutely. I mean, to think of it otherwise is really not sensible. I think we're at a point in the world that we are all we understand one part of the globe affects another part of the globe. We know that more clearly now than ever before. So the same thing is happening with this body. I have lots of patients coming to me daily saying, my doctor will look at my toe and or look at my foot and only address my ankle. But I have a neck problem, a shoulder problem, but they can't deal with it. So there's no connections, even with their own body, that the doctor will consider. Mm-hmm. Which is unfortunate.
Yeah.
I agree.
So recently I've also been studying a method of sound therapy, and in that practice we describe the body as always looking to maintain its balance and looking to maintain equilibrium and health. But sometimes it gets out of balance and can't by itself regain equilibrium. But if you give it the right, in this case, sound frequencies in the right way, in the right places, it can say, oh, that's right. That's the way it's supposed to be, and it can kind of adjust itself and come back into balance. Can you describe how that works in your...
Oh, yes. No, method? Excellent. It's absolutely true. I absolutely agree. I see that myself in my practice. So the way I would describe this to everyone, it is as simple as if you sprain an ankle. Your body does not have the ability to sort of catch. If you sprain an ankle, you've sprained the ankle. As soon as that happens, your joint positions are misaligned. Your body will now, it won't be fast enough to catch it, which is an interesting story in itself, but your body won't catch the sprain, so you'll actually have a misalignment in, let's say, your ankle. That misalignment now is going to be stabilized rapidly, so quickly, by the muscles, by virtue of your whole balance center with that myofascia. So it's going to hold that ankle in a stable position. That stable position is not the same stable position because it's injured. So that reality is now communicated instantly with the rest of your body saying, hey, I've just rolled my ankle. And everyone's going to pay attention. Why? Because we're bipedal and we're walking. And understand that with this bipedal nature, if we are not stable and standing, we could fall over and be eaten. So our survival is first, it's got to stand without falling, and then to run. Any threat to that mechanism is huge, right? So if you sprain your ankle, your body quickly will adjust itself. It'll compensate. It won't reset that position of the ankle. It'll just stabilize that twist, which means you're not going to use that leg much. It's going to shift the energy to the other side. It'll shift the pelvis, shift your jaw, shift your neck, and say, oh, got it. I got it. I got it. I got it. Yes. Okay, fine. So within minutes, you can still stay, you can be okay. And with an ankle, 3 weeks, you can't even remember it consciously. But your body memory can, for sure. And understand that that body memory says, I've picked up an injury, got it covered, I'm balanced enough. You're not balanced, you're balanced enough. The body doesn't return to true balance. It does not do that and will never do that. It doesn't have the mechanism to do that. So what you will have then, unfortunately, is an accumulation, typically, of a lot of micro traumas affecting different parts of our body that the body says, oh, I got it, I got it, I got it, I got it. And what happens is, like I see a lot of youth athletes are doing fine, but if they don't correct by the age 20, 25, they can't function or do anything like they had done prior, right? Until maybe in their 40s or 50s they take up yoga or something, right? So there is this problem with the human body where it accumulates injuries and it resets its balance center to be, I'm enough, I'm balanced enough. That's okay, I typically tell my patients, well, that's sort of okay if you're on the couch forever, but that's not really life. And so if you do want to actually use those legs and have balance enough to play golf or bend over and pick up a filing paper, right? So you actually have to go back in there and you have to explore, well, if I'm not moving like I did when I was 16 years old, and other people my age at the office are working and moving as well as I can, what the heck's the problem? Is it my marriage? Well, it can be more simple than that. It can be, oh, I played a lot of, or in the case of men, it's skateboarding. I'm not picking on skateboarding, but I'm going to tell you. There's accumulation of a lot of the injuries from the young will get you to, when you're middle age, that they will begin to diminish the function as a result of accumulation of injuries. So I agree with you, the body doesn't rebalance itself, but if you give it an opportunity, it will. And that's really what my practice is about. It's about identifying these injury patterns that are in that myofascial matrix that are convincing your body, oh, I can't move on that right side, I got a bad ankle. 20 years later, right? And it's kind of crazy. So I'm sure you found that in your practice with yoga, there's lots of restrictions on these patients. And then after a while, they'll tell you things like, oh, yeah, I fell off a roof years and years ago, and you've been working with it for a long time, trying to release that kind of tension, who can't, keep a position as long as they could. So yeah, I find, yes, balance is critical. It's really important for the body to maintain that equilibrium, doesn't want to fall over. But more to the point, I find that it isn't the quality balance that is enough to make them functional, youthful any longer. And that is still available by that work of releasing all that tension and all that history that's locked into that myofascial matrix. And again, same basis of thinking in yoga, I'm pretty sure, where, hey, your body has that story. Let's release it. Let's find out what it's talking about. Let's own it. Let's sit with it. Let's release it.
Longevity of function is one of the main goals of yoga, and it sounds like your work as well.
Yeah, guilty. Yes.
Most of us don't know how to breathe. It's just something that we've never thought about, and we're actually breathing in a way that really increases our stress and doesn't fully oxygenate the body or the brain. And in yoga, we're always trying to help people to breathe more slowly, more deeply, but it can actually be very challenging, and we can easily go back into our pattern of stressed breathing. So I'm just wondering, what is the role of breath in your work? Do you pay attention to it, or how does it play into what you do?
Yes, Shakti, thank you for asking that. It's one of my, worked through years of looking into and researching, okay, what are the key things in the body? What does it want to do? Certainly balance and standing and movement is there, but it's integral with the breathing. And what I do know now is it's part of the peculiarity of the human body as opposed to any other animal. We don't have the correct ability to stabilize the head during fast movements, which is to say our neck, our sensitive area, the brainstem, is constantly shifting through stress and is never actually located correctly, which is why people have tight TMJ. Because as soon as your head position shifts and changes, your jaw will start to clamp down. In fact, your cranial plates will twist to try to push your atlas on straight. So cranial balance and cranial patterns are actually diagnostic through breathing tests that we use, right? So I find that just it's a huge problem not being able to breathe, and unfortunately I don't see it as simply resolved as repetitive coaching through it. It's like sometimes we need to do some release work through the cranium and through the neck to get your body to release events. So fascial patterns are everywhere, and in the upper neck and the jaw and the cranium is a very typical place that will have the fascial tension. That speaks about trauma. And as much as I'd like everyone to breathe, I understand it is a big problem as well for my practice.
We work a lot through conscious meditation and exercise, deepening the breath, breathing into your belly. There's lots of different pranayama exercises that can help, but what I'm hearing from you is that you're able to address issues that are actually in the unconscious for people, whereas we might not be able to get them there through conscious meditations. You can then take it from there and find the root.
Yes, that's sort of my mission really is to work with that subconscious, that body consciousness that will reveal information about what the body had gone through during different events that their neurologic consciousness may have forgotten. And certainly what you see and what I see in practice is a lot of breath holding, incorrect pattern of breathing, shallow breathing, which really I understand is part of the movement body, and unfortunately it's really part of the cardiovascular system, which in an ideal world I'd want more people to be aware of how we breathe as it relates to heart disease. So yeah, thank you for bringing that up. It's really important, and I appreciate you sharing with us this afternoon your yoga background and my connection with how can Dr. Akers' patients, where do they go after a few release treatments through the fascia, as well as certainly continuing the work with opening your body, having your fascia smooth, opening and breathing with a yoga practice as well. So thank you for being here.
You're welcome, my pleasure.